Every 90 seconds, somewhere in this country, another person suffers a stroke. That number alone should stop you in your tracks. But here is what truly should disturb you. In nearly 80% of those cases, the body sent warning signals in the hours, the days, sometimes the entire week before the event. Signals that were felt, signals that were noticed. Signals that were dismissed as fatigue, as stress, as getting older, as nothing. And by the time the ambulance arrived, those signals were no longer warnings. They were the funeral march of brain tissue dying minute by minute. What you are about to learn in the next 20 minutes is not what your physician will tell you during a routine appointment. There is no billing code for teaching prevention. There is no 15-minute office visit long enough to walk a patient through the subtle neurological whispers that precede catastrophic brain events. The system you rely on for your health is not built to keep you healthy. It is built to treat you after the damage is done, when the bills are large and the interventions are profitable. Subscribe to Dr. Waterling right now and press that like button. The channel is working toward 1,000 subscribers, and it is being built on one principle. The principle that ordinary people deserve the same knowledge that sits inside neurology textbooks, locked behind medical jargon and institutional walls. Every subscriber moves this mission closer to the people who need it most. Now listen carefully, because what comes next could be the most important 20 minutes of your year. In 15 years of clinical practice, the pattern has been seen again and again. A patient is rolled into the emergency department, one side of the face slack, one arm useless, speech reduced to slurred fragments. The family is gathered, the questions begin, and almost always the same answer emerges. Yes, there was something. Yesterday she dropped her coffee cup and laughed about it. Last week he stumbled coming out of the bedroom and blamed the rug. 3 days ago, her vision went strange for about a minute and she rubbed her eyes and went back to reading. He had a headache last night, unusual, sharp, but he took an aspirin and went to bed. These are not coincidences. These are not aging. These are transient ischemic attacks, what medicine calls TIAs, and they are the brain screaming for help in the only language it has. A TIA is a brief blockage of blood flow to a region of the brain, lasting from a few seconds to a few minutes, sometimes longer, but resolving before permanent damage occurs. The medical community has a phrase for this. They call it a warning stroke. The problem is they only call it that after the real stroke has occurred. Before that, it gets called nothing because nobody is looking for it. Now let the mechanism become clear, because once you understand what is actually happening inside the skull, you will never dismiss these signals again. The brain weighs approximately 1,400 grams, less than 3 pounds of tissue. But that small mass consumes roughly 20% of every breath of oxygen taken in and 20% of every beat of blood the heart pumps out. The brain is the most metabolically demanding organ in the body, and it has almost no capacity to store its own fuel. Cut off blood flow for 4 minutes and neurons begin to die. Cut it off for 10 minutes, and the damage becomes permanent and substantial. Cut it off for 20 minutes and entire functional regions are lost forever. Now imagine the network of arteries delivering that blood. The carotid arteries running up either side of the neck. The vertebral arteries climbing through the bones of the spine. The smaller branches dividing again and again, becoming the delicate web of capillaries that wraps around every thinking, feeling, remembering cell. When cholesterol-laden plaque builds up on the inner walls of those arteries, the channel narrows. Blood still flows, but the passage is reduced. Then one day, a small fragment of that plaque cracks. The body, recognizing what it interprets as an injury, sends platelets to the site. A clot begins to form. That clot may grow large enough to completely block the artery, or it may break loose and travel downstream until it lodges in a vessel too small to pass through. Either way, the brain tissue beyond that point loses its blood supply, and neurons begin to die. A transient ischemic attack happens when that blockage is incomplete or temporary. The clot partially dissolves. The blood pressure surges and pushes through. The brain reperfuses, the symptoms resolve, and the person feels normal again. But the artery is still diseased. The plaque is still cracked. The clotting cascade is still primed. And the next event, the one that does not resolve, is already being assembled inside the body. Research published in the journal Stroke has demonstrated that approximately 1 in 3 people who experience a TIA will go on to have a full stroke. And of those, almost half will occur within 48 hours of the warning event. 48 hours. That is the window. That is the gift the brain is offering. That is what nobody is teaching you to recognize. Here is where it gets critical. The signs of a TIA are not what most people imagine. The dramatic Hollywood collapse, the clutched chest, the dramatic fall to the floor. Those images describe massive strokes that are already catastrophic. What precedes them is far quieter, far stranger, and far more easily ignored. Look at one hand right now. Right now, before continuing, hold it out in front. Most people see fingers and skin and perhaps a few age spots. What an experienced clinician sees is one of the most sensitive early warning systems in the human body. Because when a small region of the motor cortex experiences reduced blood flow, the first thing to go is often fine motor control in the opposite hand. The coffee cup that slips, the pen that suddenly feels wrong, the button that will not cooperate with the buttonhole, the keys that fumble at the lock, these are not clumsiness. These are the brain telling you that somewhere in a deep cortical fold, a tiny region of tissue just had a near-death experience. Now consider the face. Speech that suddenly slurs for 30 seconds and then clears. A word that will not come, a name that vanishes mid-sentence, the sensation of the tongue feeling thick or uncooperative. A mild droop at one corner of the mouth that family members notice but the person does not feel. A numbness that creeps across one cheek and is blamed on having slept funny. These are not aging. These are the language and motor centers of the brain crying out for help. Now the vision. A curtain of darkness that descends over one eye for a few seconds and then lifts. A blurring that affects only one half of the visual field. Double vision that comes and goes. The peculiar sensation that part of the world has gone missing, as though a piece of the visual landscape were simply erased and then restored. Medicine has a name for the curtain phenomenon. It is called amaurosis fugax, transient blindness, and it is one of the most reliable predictors of impending stroke in the medical literature. And yet most people who experience it never mention it to anyone, because by the time they think to call about it, the vision has returned and the moment feels unreal. Now the balance. A sudden unsteadiness while walking, a room that tilts for a few seconds, a drift to one side when standing still, the dropped foot that catches on a stair, the car that drifts in a lane the driver swears was straight. These can come from many sources, but when they appear suddenly in someone over 50 who has not had them before, they belong on a neurologist's desk within hours, not in a journal entry to be discussed at the next checkup 3 months from now. And finally, the headache. Not the familiar headache, not the tension band or the sinus pressure, the new headache. The headache unlike any previous headache. Sharp, sudden, located in a place that has never hurt before. Particularly the headache at the back of the head, at the base of the skull, where the vertebral arteries pass into the brain. This headache demands evaluation, immediately and without negotiation. A sudden severe headache that arrives like a thunderclap, that reaches maximum intensity within a minute, requires emergency services without delay. Not a phone call to the family doctor. Not waiting until morning. Emergency services. Because that headache may be the announcement of a subarachnoid hemorrhage, and the difference between survival and devastation is measured in minutes. How old are you right now? Write the number in the comments below. The channel needs to understand which age groups are watching this content, because the protocols and warnings shift significantly between people in their 50s, 60s, 70s, and beyond. That information directly shapes what gets covered in upcoming videos. Now the system failure. The reason most of these warnings get missed is not because patients are careless. It is because the medical system has been trained to dismiss them. Walk into an urgent care clinic and describe a 40-second episode of slurred speech that resolved completely 2 hours ago. The most common response will be reassurance. You feel fine now. Your blood pressure is acceptable. Probably stress. Probably dehydration. Probably you were just tired. Follow up with your primary care physician at your next available appointment. That advice has killed more people than most medications ever will, because a TIA that resolves without treatment is not a problem solved. It is a problem temporarily hidden. The underlying disease, the diseased artery, the unstable plaque, the activated clotting cascade, all of it remains in place. And the next event may not be transient at all. The standard of care in modern neurology, when a TIA is suspected, is rapid evaluation, ideally within 24 hours, including imaging of the brain and the arteries supplying it, carotid ultrasound, magnetic resonance imaging, sometimes a CT angiogram, cardiac evaluation to rule out atrial fibrillation, which is responsible for a substantial percentage of strokes through a different mechanism involving clots that form in the heart and travel to the brain. None of this happens at a routine office visit. None of this happens through reassurance. It requires the patient or family to insist, to escalate, to refuse the polite dismissal that costs lives. And here is what compounds the problem. Many TIAs occur during sleep. The person wakes with a vague sense that something happened in the night. A pillow that was wet with saliva from a slack mouth. An arm that felt strange when reaching for the alarm clock. A peculiar dream that may not have been a dream at all. By breakfast, everything feels normal. The morning continues. The opportunity passes. Now let what is necessary become clear. There is a protocol, a daily and weekly framework, designed to reduce stroke risk and to catch warning signs early enough to intervene. None of it requires expensive equipment. None of it requires prescription medication beyond what may already have been prescribed. All of it can begin today. The morning protocol begins before the feet ever touch the floor. Upon waking, remain lying down for 1 full minute. During that minute, perform 5 slow diaphragmatic breaths, drawing air down into the belly rather than up into the chest. This allows the cardiovascular system to gradually adjust to the demands of upright posture, reducing the sudden pressure shifts that can dislodge unstable plaque in vulnerable arteries. Then perform a 30-second self-assessment. Touch the thumb of each hand to each fingertip in sequence, thumb to index, thumb to middle, thumb to ring, thumb to little finger, on both hands simultaneously. The movement should feel coordinated and equal on both sides. Any clumsiness, any delay on one side compared to the other, any sense that the hand is not responding as it should, is information worth recording. Then smile broadly in the mirror and observe both sides of the face. They should rise equally. The corners of the mouth should reach the same height. The cheeks should bunch with the same fullness. Any asymmetry that was not present the day before is information that belongs in a phone call to a physician within hours. Then speak a single sentence aloud. Any sentence. The famous practice sentence used in neurological screening is, "The early bird catches the worm." The words should flow without effort, without slurring, without that strange sensation of the tongue refusing to cooperate. If the sentence comes out wrong, repeat it. If it comes out wrong a second time, call emergency services. Do not drive. Do not wait. Call. This entire morning check requires less than 90 seconds. It costs nothing. It requires no equipment. And it has the potential to catch a warning stroke at the exact moment when intervention can prevent the catastrophic one. Now, the nutritional foundation. The diet that protects cerebral arteries is not exotic and does not require expensive supplements. It centers on 3 principles. Reduce the inflammation that destabilizes plaque. Improve the flexibility of the arterial walls. Support the natural anticoagulant systems of the body without interfering with prescribed medications. Begin each day with a simple preparation. Take 1 tablespoon of ground flax seed, roughly 7 grams, and stir it into 150 milliliters of warm water, about 2/3 of a cup. Allow it to sit for 10 minutes until it thickens into a translucent gel. Drink it on an empty stomach 20 minutes before any other food or drink. The omega-3 fatty acids in flax, specifically alpha-linolenic acid, have been demonstrated in research published in the Journal of Nutrition to reduce arterial inflammation measurably within 3 weeks of daily consumption. The mucilage that forms in the water coats the upper digestive tract and supports cholesterol clearance through the bile pathway. 20 minutes later, breakfast. The breakfast that protects the brain consists of approximately 50 grams of rolled oats, half a cup cooked in 250 milliliters of water for 10 to 12 minutes. Stir in 1 tablespoon of crushed walnuts, providing roughly 2 grams of plant-based omega-3. Add a handful of fresh blueberries, approximately half a cup, providing anthocyanins that have been shown in multiple clinical trials to support endothelial function in the cerebral vasculature. No sugar, no syrup. The natural sweetness of the berries is sufficient. Throughout the day, hydration matters more than most people understand. Dehydration thickens the blood, slows flow through narrowed arteries, and increases the likelihood of clot formation. The target is approximately 30 milliliters of water per kilogram of body weight per day, which for most adults works out to between 2 and 2.5 liters. Spread evenly across the day, not gulped in the evening, which only disrupts sleep. The midday meal should include green leafy vegetables, at least 2 cups of cooked or raw greens, because the nitrates in those vegetables are converted in the body to nitric oxide, the molecule that signals arteries to relax and widen. Spinach, arugula, kale, Swiss chard, drizzled with 2 tablespoons of extra virgin olive oil, which provides polyphenols that protect the lining of the arteries from oxidative damage. The evening meal should be lighter and earlier than most people consume it, ideally finished at least 3 hours before bed. Heavy late meals raise nighttime blood pressure and increase the cardiovascular strain during the most vulnerable hours, the early morning when most strokes occur. Include fatty fish at least 3 times per week, approximately 120 grams per serving, providing the marine omega-3 fatty acids EPA and DHA that have the strongest evidence base for cardiovascular protection. Now, the movement protocol. Movement is not optional in stroke prevention. It is foundational. But the movement that matters here is not exhausting exercise. It is consistent, daily, circulation-promoting activity that keeps blood flowing through every artery and vein in the body. Walking is the foundation. 30 minutes per day at a pace where conversation is possible but slightly effortful. 5 days per week minimum. This single practice has been demonstrated in large population studies to reduce stroke risk by approximately 25% compared to sedentary controls. Add to that a simple cervical mobility practice. Sitting upright in a chair, slowly turn the head to the right as far as is comfortable, hold for 5 seconds, return to center, then to the left, hold for 5 seconds, return to center. Repeat 10 times in each direction. Then gentle tilts, ear toward shoulder, 5 seconds each side, 10 repetitions. This practice maintains the flexibility of the soft tissues surrounding the carotid and vertebral arteries, which can become restricted in people who spend long hours looking at screens. A note of caution here. If there is known significant carotid disease or a history of cervical spine injury, these movements should be discussed with a physician before beginning. The goal is gentle mobility, never force, never rapid spinning of the head. Then a simple practice for venous return and cardiovascular conditioning. Stand upright, feet shoulder width apart. Rise onto the balls of the feet just 2 centimeters off the ground, then let the heels drop back to the floor with a light, firm impact. A mild vibration should be felt traveling up through the calves into the thighs. Perform 30 repetitions at roughly 1 drop per second. This practice mechanically encourages venous return from the lower extremities, reducing the cardiac workload and supporting overall circulatory health. Now the case worth understanding. A patient, Margaret, age 67, walked into the clinic on a Tuesday morning. She had been referred not for any acute complaint, but for management of mildly elevated cholesterol. During the conversation, almost as an aside, she mentioned that she had dropped a glass of orange juice that morning. Then she laughed and said the same thing had happened twice the previous week. The questioning continued. Had there been any episodes of slurred speech? Well, now that you mention it, last Thursday her husband had asked her to repeat herself because the words had come out funny. It lasted maybe a minute. She thought she was just tired. Her blood pressure was acceptable. Her heart rhythm was normal. By every routine measure, Margaret was a healthy 67-year-old. But the history was a series of textbook warning strokes. She was sent directly from the office to the hospital for urgent imaging. The carotid ultrasound revealed 78% stenosis of the right internal carotid artery. The MRI showed 2 small regions of recent ischemic injury, silent strokes that had not produced lasting symptoms but had absolutely damaged tissue. Margaret underwent carotid endarterectomy within 48 hours. The plaque was removed. The artery was reconstructed. She walked out of the hospital 5 days later, neurologically intact. 3 months later, her husband sent a card to the clinic. It said simply, "You gave me back the rest of my life with her. Thank you for asking the second question." The second question. That is the difference between a life saved and a life lost. The first question is, how are you feeling today? The second question is, has anything strange happened recently, even briefly, that you dismissed at the time? Now, the warnings that cannot be overstated. The signs that require emergency services without delay, without negotiation, without a phone call to anyone other than emergency dispatch. Sudden weakness or numbness of the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking, or trouble understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance, or coordination. Sudden severe headache with no known cause. If any of these symptoms appear, even if they resolve quickly, the call must be made. Time is brain. Every minute that passes during a stroke, approximately 1.9 million neurons die. The treatments that can dissolve clots and restore flow have a narrow window of effectiveness, typically the first 3 to 4.5 hours. After that window, the options narrow dramatically. A note about medications. If currently taking blood thinners, blood pressure medications, or cholesterol-lowering drugs, none of the recommendations in this video are intended to replace those prescriptions. Nutritional and lifestyle interventions work alongside medical treatment, not instead of it. Any dietary additions, particularly the omega-3 sources and the green leafy vegetables that affect vitamin K levels, should be discussed with the prescribing physician, especially for those on warfarin, because interactions can occur and dosages may need adjustment. Never discontinue prescribed medication based on information from any video. The framework just described is not exotic. It is not expensive. It does not require any special equipment beyond a chair, a pair of walking shoes, and a kitchen. But it requires consistency, and it requires the willingness to take the small signals seriously. The dropped cup, the 40-second slur, the brief curtain of darkness, the unfamiliar headache, the morning that begins with a strange numbness that fades by the time the coffee is poured. These are not the inconveniences of aging. These are the brain offering a chance, sometimes the only chance, to act before the damage becomes permanent. If this video has been useful, send it to someone who matters. A parent, a spouse, a friend who has been brushing off something that didn't quite feel right. The act of forwarding this conversation may give that person the recognition, in a moment that has not yet arrived, that what is happening to them is not nothing. It may give them the impulse to make the call that changes the outcome. Subscribe to Dr. Waterling if this content has provided value. The mission is to bring the kind of clinical knowledge that lives inside neurology textbooks into the kitchens and living rooms of ordinary people. Every subscriber moves that mission forward. Press the like button, leave the age in the comments, and come back next week because the next video will address a related signal that is even more frequently dismissed than the ones discussed today. The body is not the enemy. The brain is not betraying anyone. It is signaling. It is asking for attention. And once a person learns the language those signals are spoken in, the conversation between body and mind becomes one of the most powerful tools for staying alive, alert, and present in this life for many more years than most people ever expect. Stay attentive, stay informed, and take the second question seriously. Because somewhere in the next 90 seconds, someone in this country is having a stroke. And the difference between that person and the one who caught it in time is exactly the knowledge that was just shared in this video.